How you can reverse. Type 2 diabetes and go into remission. Type 2 diabetes, once deemed a lifelong sentence, is now recognized as a reversible condition through targeted lifestyle and medical interventions. Emerging research, including the 2025 American Diabetes Association Standards of Care, underscores that remission, defined as sustained normal blood glucose levels without medication, is achievable for many patients. This script synthesizes cutting-edge scientific evidence, clinical strategies, and real-world success stories to empower individuals on their journey to remission. Type 2 diabetes arises from insulin resistance and pancreatic beta cell dysfunction, often driven by excess visceral fat. The twin cycle hypothesis from Newcastle University reveals that fat accumulation in the liver and pancreas disrupts insulin production and glucose regulation. Shedding this fat, even modestly, can reset metabolic function, a breakthrough validated by the landmark DIRECT trial, where 36% of participants achieved remission through weight loss. Remission is categorized as complete, HbA1c below 6.0% without medication for at least 3 months, or partial, HbA1c below 6.5% without medication for 1 year. While remission doesn't mean a cure, it signifies metabolic recovery, reducing risks of complications like neuropathy and cardiovascular disease. Dietary changes are the cornerstone of diabetes reversal. The NHS England Path to Remission program uses low-calorie diets, 800 to 900 kilocalories per day, to induce rapid weight loss, with participants losing an average of 10.3 kilograms in 12 months and 35% achieving remission. This approach mimics fasting, depleting liver and pancreatic fat to restore insulin sensitivity. For example, a 2017 study in The Lancet found that 46% of participants on an 850 kilocalories per day diet achieved remission at 1 year, sustained in 70% of those who maintained weight loss. Low-carbohydrate diets, under 130 grams per day, also show promise by reducing post-meal glucose spikes. A 2025 BMJ study combined a 500 to 750 kilocalories per day deficit with the medication dapagliflozin, resulting in 44% remission rates. Mediterranean diets, rich in plant-based proteins and omega-3s, further improve glycemic control and cardiovascular health. The ADA emphasizes personalized nutrition, such as the plate method, 50% non-starchy vegetables, 25% lean protein, and 25% whole grains to balance nutrients and calories. Physical activity enhances insulin sensitivity by reducing visceral fat and increasing muscle glucose uptake. The ADA recommends 150 minutes of weekly aerobic exercise like brisk walking paired with resistance training twice weekly to build muscle mass. A Yale study found that combining aerobic and resistance training lowered HbA1c by 0.8% in 12 weeks, rivaling the efficacy of medications. Weight management is critical. Newcastle University's research identifies a personal fat threshold, the weight at which fat accumulation triggers diabetes. For most, losing 10 to 15% of body weight resets this threshold. A 5 to 10% loss improves insulin sensitivity, while a 15% loss raises remission likelihood to 70 to 90%, especially within 6 years of diagnosis. For instance, a 45-year-old with a BMI of 32 lost 15% of their weight, 22 pounds, via a 12-week low-calorie diet, reducing HbA1c from 8.5% to 5.7% without medication. For those struggling with lifestyle changes alone, medical interventions offer solutions. GLP-1 receptor agonists and SGLT2 inhibitors promote weight loss and glycemic control. The 2025 ADA guidelines highlight their role in sustaining remission, particularly for individuals regaining weight. Bariatric surgery, another option, induces remission in 60 to 80% of patients by altering gut hormones and fat distribution. A 10-year follow-up study found 31% maintained complete remission, with sustained improvements in HbA1c and cardiovascular health. For example, a Saudi cohort study showed 27% remission post-surgery, though long-term weight maintenance is crucial to prevent relapse. Monitoring and support are keys to long-term success. Continuous glucose monitoring, CGM, now ADA recommended for non-insulin users, helps track post-meal trends and refine diets. Structured programs like the NHS's Path to Remission pair low-calorie diets with behavioral coaching, achieving a 33% remission rate at 2 years. The Yale Diabetes Research Center uses multidisciplinary teams to address psychological barriers to weight loss, ensuring holistic care. Real-life success stories illustrate these principles. Richard Dowdy reversed his diabetes in 11 days using an 800 kilocalorie per day diet and maintained remission for 5 years with a low-carb Mediterranean diet. The documentary, Fixing Dad, follows a man with a 20-year diabetes history who achieved remission via gastric bypass, losing 100 pounds and normalizing his HbA1c. A 60-year-old direct trial participant lost 33 pounds, stopped metformin, and sustained an HbA1c of 5.8% for 5 years. Challenges remain, particularly weight regain. A 2025 Lancet meta-analysis notes relapse rates of 24 to 35% post-intervention, emphasizing the need for lifelong lifestyle adherence. Emerging therapies, like thyroid hormone receptor beta agonists to reduce liver fat and artificial pancreas systems, aim to enhance remission durability. In conclusion, reversing type 2 diabetes demands a personalized, evidence-based approach. By combining dietary rigor, physical activity, medical innovation, and sustained support, millions can reclaim metabolic health. As Dr. Roy Taylor asserts, type 2 diabetes is a simple condition of excess fat. Remove the fat, and you reverse the disease. The path to remission is challenging, but profoundly liberating, offering a future free from diabetes' shadow.